Thank you, Mr. President. I rise as a representative or a senator from a rural district, and it's in fact the most rural district in the state. I represent communities where there isn't always a backup hospital down the street, where it's often that you can't find another pharmacy across town, where if something closes, it's not just an inconvenience, it's a crisis. And right now, that crisis is staring us right in the face, because the 340B program is one of the last real lifelines keeping rural healthcare standing in places across greater Minnesota. And let's be honest about what this program is. It was created to help hospitals that serve a disproportionate share of Medicare and Medicaid patients to keep their doors open. Because here's the reality. Those programs don't pay the full cost of care. So rural hospitals are left trying to do more with less every single day. 340B was created to help fill that gap so that they can keep emergency rooms open, keep pharmacies operating in rural towns, and essential services available regardless of your zip code. That's what this is about. And yet today, we have pharmaceutical companies openly disregarding Minnesota law. Not bending it, not debating it, ignoring it. Let's be clear, this isn't a fair fight. On one side, you have rural hospitals, local pharmacies, and patients in rural communities. On the other, you have some of the most profitable corporations in the world. U.S. pharmaceutical profits in the U.S. exceeded $100 billion last year. Hospital margins are often between 1% and 5%. And in fact, 40% of rural hospitals are operating in the red. At the very same time, we have the federal big, beautiful bill, which is an oxymoron, putting more pressure on healthcare, cutting Medicaid, shifting costs onto states and our counties, and squeezing the exact hospitals that we're talking about today. So let's get this straight. Some of the same folks who support the big, beautiful bill are now saying we shouldn't enforce the very programs that were created to provide the gap funding for rural hospitals in greater Minnesota. That doesn't add up. And here's what should concern everybody. Big Pharma is spending enormous amounts of money to confuse average Minnesotans. The estimates are $1 million a day. We've heard a lot of discussion about how we could discount costs for local patients. Well, my question is, why doesn't Big Pharma take the millions of dollars they're spending on ads to confuse average Minnesotans and provide discounts to those patients? Seems pretty easy to me when you have $100 billion in profits. If they were on the right side of this issue, they simply wouldn't need to try to muddy the waters with ads. You know, in 2023, we passed a PBM reform bill. And at the time, Big Pharma spent millions of dollars in ads against senators like me. And the problem was they put the ads on billboards in Minneapolis and St. Paul. I don't know how many of you know, but I represent the Iron Range in northern Minnesota, not Minneapolis, St. Paul. So the ads seemed really odd to me. But when you have hundreds of billions in profits, I suppose you can spend money on billboards anywhere you want. And the funny thing was, I had a family member in the Twin Cities see the billboard. And she decided for Christmas she would play a little joke, and she had one of those little mini billboards created with the ad and gave it to me for Christmas. Well, I proudly displayed that billboard in my office because I will always stand with patients and rural hospitals over Big Pharma. So my question today with this is, what is the next billboard that Big Pharma will have in Minneapolis and St. Paul targeting me and trying to take me out? Members, this debate is very simple. Do you stand with patients and hospitals, or do we stand with the pharmaceutical companies trying to avoid accountability on Minnesota law? Recently in my district, we had a little roundtable with community leaders in Lake County. And a rural hospital leader stood up in front of everybody and said, if we don't remove the sunset on 340B, if we don't add enforcements to the 340B program, rural hospitals will close. Let me repeat that. A rural healthcare leader said, if we don't remove the sunset on 340B add enforcement language, and ensure that Big Pharma is paying their fair share, rural hospitals will close. And once a rural hospital closes, we know they don't come back. This bill is simple. It removes uncertainty. It simply enforces existing Minnesota law, and it ensures that Big Pharma plays by the same rules as everybody else. And other states have done this. Blue and red states. There's not a distinction. This isn't partisan. Other states have done this to ensure that their laws are followed. So I'll close with this. I'm proud to be the senator from the most rural district because I know firsthand what's at stake. This is about whether people have care close to home. So we can stand up today and we can protect it, or we can stand with Big Pharma and continue to dismantle rural health care just like the federal government has with the big, beautiful bill. I know where I stand. I hope you do too. Thanks.